Hey everybody. Yesterday we did Trump Care as a follow-up to Obamacare, and I want to do one more real quick video lecture on the movement called Medicare for All that's really taken off and gathered speed and momentum in the last couple of years. And now with COVID-19 and 40 some odd million people who lost their jobs, and many of whom will then lose their insurance, this issue is going to get really, really big. So let me just run through why is Medicare for All gaining momentum? And again, it was before COVID-19, and it's going to pick up more now. Number one, healthcare costs are just going up inexorably. The cost of insurance keeps going up and going up and going up, and it's hit $20,000 for a family policy. And it's squeezing out things we want to pay for. Pay increases, tax cuts, K through 12 education investments. Anything else you want to spend money on, there's less of it because health insurance and healthcare is eating up more and more of it every year. And the big thing are these deductibles that keep going up. You read about that in the critique of Obamacare, and even the people who fashioned Obamacare, looking back and realized that they didn't get a handle on deductibles. And deductibles are what you pay out of pocket when you need health care before your health insurance kicks in. In other words, before your health insurance starts paying bills, you got to pay the deductible. And it's been going up faster than premiums, even than wages, everything. Deductibles are going up and up and up. And then just another, like sort of a symbolic example, but really, really pertinent to people who are type 1 diabetics, who have type 1 diabetes. It's just the reality in our country that people can't get insulin, and they can't afford it. It can cost $1,000+ per month, even with insurance, much less without insurance. And these stories of parents, I have to go past them quickly, but parents who lost children who ran out of insulin, again, talk about a national freaking disgrace that we can't get a drug that was discovered in 1921 and should be as cheap as Tylenol has gone up in price. And it's just a reflection of the capitalist part of our healthcare system run amok, because healthcare has been a business and it's made good money. Right now with COVID, it's probably not making good money. But this goes back again to that point we discussed earlier, which is the more and more you spend on healthcare, the less and less you have to spend on so many other things that we want to spend money on, right? And you guys this is a long text slide, so I'm definitely not going to read it word for word, but let me just distill it to you, and then I want you to go back and read it carefully. I actually attached it as an attachment yesterday. If you guys are worried and concerned about college debt and maybe med school debt or graduate school debt, and you should be, it bothers me immensely how much debt we put on 20-somethings. Realize that college debt has gone up in connection to healthcare costs, because as healthcare costs get more expensive, schools have to pay for it. We have to pay more for Medicaid. Then schools have less money to give out in student grants, and we also have less money from the state to pay for public schools because they have to pay more for things like Medicaid and prisons. So this is in a nutshell what opportunity costs are. The more we spend on healthcare, the more our Medicaid costs go up, the less we have to spend on students to keep their debt down. And my wife's a teacher. Her pay increases for years have been very modest, and the reason is her health insurance costs keep going up year after year. So health insurance costs are eating up our wage increases, right? And right now, of course, we're living through this reality that people who are most vulnerable are the ones who have lost health insurance and can't stay at home. Their work is this. It's working, it's interfacing, it's moving, it's transportation. They can't stay home and earn a living. Only about 40% of the US population can actually earn a living at home. 60%, no way. So another reason why there's growing interest in Medicare for All, go talk to a doctor or nurse about electronic health records and administrative record keeping and charting and all of the computers they have to stare at and enter data into. And why is that becoming more and more onerous? Because we don't have one standard system, one standard operating mechanism for billing and charting and paying bills and reimbursing providers. We have all these different private insurers that have different forms. We have Medicare and Medicaid, and a lot of doctors and nurses are like, for God's sake, just give us one system. make it efficient, standardize everything, and get these computers away from us that we have to spend all day on and go home at night and enter more data into. That's why a lot of doctors and nurses are now like, come on, bring it on. Medicare for all would just return, or we might make a little less money in Medicare for all, but we'd get 2 or 3 hours back in our life every day. And I'm telling you, when you get to the point where you're working all day and going home and doing record keeping for computers for administrative and billing purposes, you're like, the hell with that. I have no life left. I want to get back to a life. So let's standardize these forms. So you guys can read the good and the bad. There's good things about a Medicare for all. Expands coverage. There's some financial savings because you have efficiencies. There's individual benefits that would help people if they had. And what's the downside? Well, it would be some money up front. You'd have to pay more to cover 20, 30 million people. It would pose some disruption to the industry because you would basically standardize everything into one form. And there are claims that it would hold back innovation because there's not as much money to be made. And I'll let you all wrestle through those pros and cons as you see fit. I'll just leave it at that. I will say Donald Trump has been all over this. He was going to do this and that in healthcare. He was going to replace Obamacare with a better thing. And right now, it's just not really a priority. And he sort of punted on the thing and just he got rid of the individual mandate. But he's not really into healthcare. So all these different plans now, it's basically whatever Joe Biden's plan is. But his is a more sort of moderate, middle ground position between. Actually, I'll tell you in a nutshell what Joe Biden wants to do. Joe Biden wants to do the original Obamacare plan before the Supreme Court modified it and sort of watered it down and weakened it and gave the states the right to do or not do Medicaid expansion. Joe Biden wants to do the original full-throttled Obamacare plan. So you guys can click through these. How do people get their health insurance? Bernie Sanders wants Medicare for all, Canadian, British style of national health care and national health insurance. Elizabeth Warren was in the middle of Joe Biden and Bernie Sanders. She was closer to Bernie Sanders, which is let's do that, but let's take a little more time to get there. Joe Biden and the other candidates were like, let's just do a full Obamacare. How much do people have to pay for healthcare? Under Bernie Sanders, very little. Elizabeth Warren, not so much. Joe Biden, a bit more. Which medical services are provided? Bernie Sanders, the most generous. Joe Biden, sort of less generous, but more generous than what we currently have. How much are medical providers paid? You can click through this. Bernie Sanders he'd pay them based on Medicare rates. So you'd have to assume that medical providers would take a little bit of a pay cut under a Bernie Sanders plan. They would. If there's an upside, is they would just have one system to deal with, and they would free up so much of their time. You'd have to leave it to them to tell you, but I would say most clinicians I talk to would be glad to take a 5% pay cut if they could have 2 hours back to their lives every day and not deal with all the different administrative structures. Bernie Sanders would have taken more taxes, and so would Elizabeth Warren's plan. Joe Biden, not as much, but some more. And again, so this is in a nutshell. Biden wants to double down on the ACA and expand it. That's it. So go back to the ACA and then even make that a little bit more generous. But Joe Biden is not pushing Canadian-style national health insurance, and he's definitely not pushing a British national health system, national health service. He just wants Obamacare plus. Now, here's an interesting model, Medicare Extra for all, which would basically be bring back the public insurance option from the original Obamacare plan. And it's really clever. All individuals in the United States would be automatically eligible, not enrolled. All individuals in the US would be automatically eligible for basically Medicare if they wanted to. And it would be Medicare Extra because Medicare doesn't cover everything currently. It has all kinds of things it doesn't cover. And under Medicare Extra, it would be more like a standard health insurance plan. It would cover more things. But here's how you would do it. It'd be based on your income. Families with income up to 150% of the federal poverty level, zero premiums. You're basically, under Medicare Extra for all, you're basically expanding Medicaid. If your family income is between 150% and 500% of the federal poverty level, then from 150 to 500, your premiums would go from 1% to 10% of your total income. And then if you wanted to get into Medicare Extra for all and you had income above 500%, you'd be capped at 10% of your income. You could get into it, you'd pay 10% of your income. And I've already sent you guys, I feel like sometimes I'm a paid spokesperson for Australia's Medicare program and their health system. You can click on this. What can Australia teach America about healthcare? I think it has a lesson because Australia has a Medicare plan That's public health insurance for everybody. You're born with it, you die with it, but it's not overly generous. It's like an adequate basic plan. And then half the country buys private insurance to get you all the extras. So you don't have to wait in line. You get a doctor of your choice. You get to go through much quicker. You get a better room. I mean, everything is just amplified with more amenities. And so it's sort of a nice, and they have their ranking is the highest ranking in international comparisons between health systems. There's no in the public system. There's no co-payments or deductibles. So the public system is just always there whenever you need it. It's not glamorous. You don't always get all the choice. You have to wait in lines. You have to get rationed. This is just the journey of the system in Australia. The way I remember putting this in. Australia has a pretty robust private health insurance industry. And the way to think of the private health insurance industry is as a big old fast pass, which is everybody who goes to the Disney World can go on rides, but you get X number of fast passes. And that means you get to jump the line and go right to the front a couple times a day. And private health insurance in Australia is the equivalent of a health insurance fast pass. So everybody has health insurance from the public Medicare system in Australia. And then private insurance is this extra card that says, hey, you get to go around and do you get to get everything faster and quicker. So these are wait times for all these procedures. If it's gold, that's private insurance wait times. The blue is the public. So this is like public school, that's private school. Public school can be good enough. You don't need to buy private. So that's the analogy. And why is that model interesting to the United States? Because we're already halfway there as it is. So Australia is just us. It's just like the United States system, but it just covers everybody with the public system. It just closes all the gaps and all the holes. Now, they still have problems. I think my recent research of Australia's healthcare system is that some people are, the private health insurance industry is experiencing a little bit of a struggle because people are saying, well, the public system is good enough. Why do I need to pay extra out of my pocket for private health insurance? Well, I'll just stay in the public system. And if more and more people do that, then the people who stay in the private system are the ones who are really sick and need the extra care. And then you get a death spiral because then the insurance gets more and more expensive, covering fewer and fewer sicker and sicker people. So that's it. That's the problem. And so we'll just close off this overview of Medicare for All by saying the guy who helped design the Affordable Care Act, he is a Democrat, Dr. Ezekiel Manuel. He thinks overall that the whole Medicare for All thing is too far down the line, and that Democrats are skipping essential steps first to get to that. And the main thing is just affordability and cost. His argument is you just got to get that they should skip the argument over Medicare for All and find the best ways to tackle affordability. Bring down the costs of insurance and healthcare first, then that enables you to get to Medicare for All. But his argument is you can't skip affordability and lowering costs. Cost control, cost reductions have to come first, and then you get to Medicare for All. And these are all the things he thinks you could do to try to get costs down. Okay. You guys watched that. That was great. Take care. I will see you all.
You have stopped screen share.
See you all later.